In order to document the encounter codes for today's visit, click the Open icon associated with the Office Codes checklist. Your checklist will be customized to your practice, so keep in mind it may look slightly different than this. To select the applicable code, click the green plus sign next to the encounter description. You will then be presented with the Order Procedure dialog, where you have the option to attach supporting information to this code for billing purposes. The order date will default to the date of the note. However, if that is not applicable, please remember to change it here. If you need to attach a modifier to this code, click the ellipsis icon under Procedure Modifiers to select from a list. You have the option to attach up to 4 modifiers. Next, select the applicable diagnosis that warrants this encounter code. Click the drop-down, and you will see a list of the patient's current or pre-existing diagnoses that exist in their chart. If you do not see the diagnosis you are looking for, you will have to close this dialog and enter it through the diagnosis checklist first. You can select up to 5 diagnoses for each procedure code. You also have the ability to modify the order of the diagnoses by highlighting the code and using the green up and down arrows to move its position. This is important for billing purposes, especially if you are sending charges electronically from clinical to practice manager. Speaking of billing purposes and sending charges electronically, if you are charging for this encounter code, make sure the Q Charge checkbox is selected. If you are documenting a code for a procedure you didn't actually perform today, you can click the Procedure Not Performed checkbox and then add a reason as to why in the comment field. If the procedure was not performed, notice that Q Charge is grayed out, indicating that you cannot charge for this procedure. Lastly, you have the SNOMED section. This will allow you to attach a SNOMED code or codes to this procedure, which is typically done for quality reporting purposes. The first time you select a particular procedure, you will have to attach a SNOMED. However, subsequent uses of this code may already have the SNOMED attached if you saved your selection the first time around. After selecting the SNOMED, you would have clicked Save from the User Defaults section to do this. To attach a SNOMED, click Search. Then start typing the description of the SNOMED code and highlight the applicable code once you find it. Then click OK to return to the Order Procedure dialog. If you selected the wrong code, you can click Delete to remove the code and then search again for the correct one. Modifiers may also have SNOMED codes attached, so keep in mind you will see them listed in this dialog along with the procedure code, and SNOMEDs would be attached in the same manner. Click OK when you are done entering supporting information for this procedure code. You will then be taken back to the Office Codes checklist with the option to add more codes if necessary. If you do not see the code you are looking for in the favorites list, you can click Search/Add Procedures from the bottom to search the database. You will have the option to search by description, CPT code, or LOINC code. If you would like to remove a code from this encounter, click the red minus sign to the left of the procedure in the summary section located on the left. If you would like to modify the supporting information associated with this code, click the Edit Procedure icon to open the Details dialog. When you are done adding office codes for this encounter, click OK to close the checklist. You will then see the information populate the current chart note.